Hello and welcome to the Queen Elizabeth Patient Podcast. I'm here today with Pauline Connelly in the Proto building in Gateshead. We're here today to talk about Oncotype DX, which is a very new resource which is used in the Trust currently. Pauline, can you just tell us a little bit more about the Oncotype and when a patient might hear this being discussed in their care plan?
So Caroline, Oncotype DX is one of the gene tests that are available. There are several gene tests out there, but this is the test that our region has adapted. It was used in trials for quite some time before it's been established. Now there's a very strict criteria for your cancer to have an Oncotype DX. So if your cancer is suitable for this gene test, it's automatically done, and it's actually done from our MDT, which is the meeting where our oncologists, surgeons, pathologists and radiologists and nurses all sit and discuss each individual lady. So once a lady's had a surgery and the histology results are being discussed in the meeting, if their cancer fits the criteria of an Oncotype DX, it is done automatically. And this test is only appropriate for ladies who have estrogen positive cancer and HER2 negative cancer. One of the reasons being, Caroline, is that we know a HER2 positive lady will benefit from chemotherapy because of the Herceptin she's going to receive, and her Herceptin and chemotherapy is linked in the licensing of receiving Herceptin. So this is for the ladies who are a HER2 negative, they're ER positive cancers. There's no disease in lymph nodes apart from a micromet, and the oncology team liaise with the pathology team and they send off a sample of their tumour. It's actually over in the United States.
So it goes off on its holidays?
It goes on its holidays in a plane. Unfortunately, we're not allowed to escort it. And they do a gene profile, and this comes back as a score. So when you see your oncologist in the clinic, which is a few weeks after your surgeon has given you your histology results and then explains to you whether you need chemotherapy or not, and some ladies will be told there and then, yes, you need chemotherapy, no you don't, and there'll be a few ladies who have had an Oncotype performed and the surgeon and the breast nurse usually explains, actually we're not sure of the benefit you receive from chemotherapy, therefore this test's been performed. The oncologist will have the results for you when you see them in clinic, and those results will guide the oncologist, and the score is between 0 and 100, and depending on the score will help guide the oncologist on whether you benefit from chemotherapy or not.
So it's just a really good test to help with the decision process,
Yes.
really,
Yes.
isn't it? But I suppose if some ladies have already made that decision, regardless of the oncotype, that they want chemotherapy, you know, and there is a small benefit there, would you say it's worth doing the oncotype?
That's usually for a discussion between the oncologist and the patients. Often the test's already been performed before they see the oncologist, so to have that information available at the appointment is often helpful. Even if there's a low oncotype and the patient result where it indicates a patient will not receive as much benefit from chemotherapy, but they are keen, that is a discussion for the individual patient with their individual oncologist. And what we have to remember in any treatment that we do, it's a joint decision. We're a team and we guide our patients on what we advise the treatment should be, but at the end of the day it's the patient who has to have the treatment, and if they don't wish to receive it, we'll still support them. The oncologists will guide and advise what they think would be beneficial, and it's the patient, it's a joint decision and where we move forward.
It's excellent, really, because I suppose it's just for some patients, suppose if that result comes back so low, that's decision made is helped to make that, doesn't it? So it takes away a little bit more of the uncertainty. We've got some excellent literature within the department to help guide patients as well. So if you wanted any more information about Oncotype, please, contact your breast care nurse or your specialist, and they'll be happy to send that out. But thank you very much, Pauline, for coming today and explaining that a little bit clearer as well. Thank you so much.
Thanks for organising these podcasts, Caroline.
No problem. Take care.